Now in station 2 we have the lower GI, which includes jejunum, ileum, then the part of the large intestine which start from the cecum, ascending colon. We have the transverse colon, we have the transverse colon, descending colon, and the sigmoid colon. Now first of all, how to differentiate between the small intestine and the large intestine. In the large intestine, they have three cardinal features. One of them is like they have the tinea coli, then they have the hostrations, and apart from these, they also have a fat ball that is called appendices epiploic. So these three features are there, whereby you can distinguish between the small intestine and the large intestine. Now, in the small intestine is having three parts. One is the duodenum, which we have already covered along with the upper GI. Then we have the jejunum and ileum. So you can see that these are the jejunum, and then this is the ileum. So they might ask you about the difference between jejunum and ileum apart from the identification. So you have to say what are the differences between the jejunum and ileum. Now here you can see that this is the ileum, and then this is the ileocecal wall, which here you can see it in the cecum. Now let's start about the large intestine. The first part is the cecum. So you have to identify the cecum, which is again very important. The bottom part, which lies in the right iliac fossa. So cecum is very important because we have the here is the opening for the ileum through ileocecal wall. It's a blind tube here, you can see, and from this there is one very important structure, and that is the appendix. So appendix is a part of large intestine, and it is very important here, clinically, also anatomically. So you have to identify the appendix here, which is most of the case is retrocecal, that is behind the cecum. So how to identify the appendix? Now, as I told you that for the large intestine, we have three very cardinal features, that is the tinea coli, hostration, and appendices epiploic. But you will not find these features, like you will not find tinea, no hostration, and appendices epiploic on the appendix. So the appendix is very important to identify, and it lies behind the cecum, and the most commonest site is the retrocecum. So this is appendix. Along with the appendix, you have to know about the McBurney's point. So what is the McBurney's point? McBurney's point is there is a sino-umbilical line which is from anterior superior iliac spine to the spino-umbilical line, which is from the anterior superior iliac spine to umbilicus. So it is medial 2/3 and the lateral 1/3. And at the McBurney's point, we have the base of the appendix. So what are the parts of the appendix? This is the base, and then this is the tip of the appendix. So these are the skill part. Theoretical part, you have to know what is the blood supply of the cecum and appendix. It is coming from the ileocecal artery, which is a branch of the superior mesenteric artery. So this is about the cecum and appendix, and then we have the ascending colon, we have the transverse colon, we have descending colon, and the sigmoid colon. So you have to identify all these, and then the blood vessels. The blood vessels, you will see we have the superior mesenteric artery, which is giving ileocecal artery, right colic artery, middle colic artery, and these all supply what? They supply the cecum, the ascending colon, and right 2/3 of the transverse colon. And then we have the inferior mesenteric artery, which supply the left 2/3 of the transverse colon, along with the descending colon and the sigmoid colon. So these are the branches of the superior mesenteric artery and inferior mesenteric artery. And apart from these two, there also, you might be asked about the right colic and the left colic flexure. So where is the right colic flexure? It is the junction between the ascending colon and the transverse colon. And where is the left colic flexure, which is also called as the splenic flexure, between the transverse colon and the descending colon.